The suspected woman is said to have come from Sierra Leone about 3 days ago, while in Uganda she had been feeling unwell and had been taking anti-malaria drugs. This evening she was taken to Mulago hospital.
But the good thing is that the patient has been taken to our isolation camp, and the patient will not have any contact with other patients.
That alert does not really fit in with the description of Ebola, but nonetheless we have isolated.
But while the Director General Health Services, Dr. Jane Ruth Acheng, says there is no cause for panic, she does admit that extra precautions should be taken.
We should be worried because she came from Sierra Leone. We are going to investigate and give you results. We must give you results.
She says these results may be out by midday on Sunday after the testing is done at Uganda Virus Research Institute. Uganda has been hit by Ebola before, where over 200 people died. The outbreak in West Africa, the largest in history since 1976, has claimed over 4,500 people, mostly in Sierra Leone, Guinea and Liberia, in less than a year. There are fears that it could infect about 10,000 people each week in the coming month. Deaths have also been reported in the US and Germany. The Ebola virus is transmitted to people from wild animals such as fruit bats, monkeys or apes, and it spreads in the human population through human-to-human transmission. People only become infectious when they develop symptoms, some of which include sudden onset of fever, fatigue, muscle pain, headache and sore throat. This is followed by vomiting, diarrhea, a rash, symptoms of impaired kidney and liver function, and in some cases, both internal and external bleeding, like oozing from the gums and blood in the stools. As has been the case with Marburg fever, the ministry is set to look out for any people who came in contact with the Ebola suspect. Meanwhile, there are no new suspected cases of Marburg in the country. All the suspects were tested and found negative. We are going to begin the countdown on the 21st of this month.
Yes, we begin counting 21 days. They have to be 42 from the date of when you last had the last case. So we last had the last case on the 30th when we buried. So from the 1st to the 21st is 21 days. From the 21st to another 21 days.
After this, Uganda will be declared free of the Marburg virus. Florence Nalimba, NTV.